Hello and welcome. So from today I'm going to talk about our ear anatomy. It is the seventh most complicated topic to understand in entire MBBS life. So try to focus on my videos as it has lots of parts. Mainly this ear has three parts. One is external ear, middle ear, internal ear. So today's topic is our external ear, as you can see in this photo. This external ear consists of auricle, external acoustic meatus and tympanic membrane. So first and foremost our auricle, as you can see in this photo. This auricle is basically a trumpet-like undulating projection from the side of the head, and it basically collects the sound waves and it conducts into the external auditory canal. Okay, this auricle basically consists of a elastic yellow-colored cartilage, and it is covered by skin. This lobule is consist of fibrofatty tissue. Now this auricle has lots of parts. You have to understand and remember these names. Suppose this cartilaginous border, okay, cartilaginous border, this is known as helix. Same to same, another cartilaginous projection or the border you can see from inside, this is known as antihelix. Now this antihelix has another projection at the inside. Okay, so the gap area or the fossa in between the two branch of this antihelix is known as triangular fossa. The area inferior to this antihelix, I mean another inferior branch of the antihelix, this area is known as cymba concha, and the rest of the area of this ear from inside is known as concha. As you can see, this hole is known as external acoustic meatus. As you can see in this photo, this movable small lobular part of, or the cartilaginous part is known as tragus, and opposite part of this lobule, as you can see in this part, is known as antitragus. Rest of the lower part of the auricle is known as lobule. In most of the culture, anyone can pierce this lobule for fashion purpose. Anyway, it doesn't matter. But this name matters whenever you are going to in forensic or in surgical department. So in any kind of suture or any kind of accident case, you have to mention these specific names of this ear. Now this auricle consists of two sets of muscle, as you can see in this photo, basically extrinsic and intrinsic. Extrinsic muscles are actually anterior, superior, posterior. Okay, and intrinsic muscles are basically helicis major, helicis minor, trachecus, antitrachecus, and transversus auriculi. There are only 1 or 2% people in this entire Earth's population who can move their ear on their wish, but in rest of the 98 to 99% of population of this entire Earth, these muscles are useless, or you can say these are vestigial muscles. Okay. Now the blood supply of this auricle, as it consists of arterial supply and venous drainage. In arterial supply, it consists of posterior branch of external carotid artery, or you can say the posterior auricular branch of external carotid artery, anterior auricular branch of superficial temporal artery, and very minor or few branches from occipital artery. That's it. And the venous drainage is done via superficial temporal vein and external jugular vein. That's it. The lymphatic drainage is done via parotid group of lymph nodes, then mastoid group of lymph nodes, and upper group of deep cervical lymph nodes. That's it. Now the nerve supply is done via branches from greater auricular nerve, lesser occipital nerve, auriculotemporal nerve, and auricular branch of vagus nerve. That's it. Now second point, external acoustic meatus. It is also known as external auditory canal. As you can see in this photo, it starts from the bottom of the concha to the tympanic membrane, and the entire length, I mean the average length, is almost 24 millimeter. Now the course is basically, it has three parts: pars externa, pars intermedia, and pars interna. Okay, now this external auditory meatus has two segments. One is cartilaginous and there is bony. The cartilaginous one is lateral 1/3 and the bony one is actually middle 2/3. Lateral 1/3 is actually 8 millimeter, I mean almost 8 millimeter, and the bony 2/3 is almost 16 millimeter. Now this external acoustic meatus is lined by skin and is skin epithelium, and it consists of specialized sweat glands known as ceruminous gland, which secretes cerumen. It's a wax-like substance, I mean oily substance, which protects the entire skin or along with the entire tympanic membrane. Again, the blood supply. artery supply and venous drainage. The artery supply is done by the posterior auricular branch of external carotid artery and deep auricular branch of maxillary artery and anterior auricular branches of superficial temporal artery done. And in venous drainage, it is done by external jugular vein, maxillary vein, and pterygoid venous plexus. And the nerve supply is done by the branches of auriculotemporal nerve and the auricular branch of the vagus nerve. So today up to this much. In next video, I will talk about tympanic membrane. See you soon. Till then, bye.